Are you dealing with hair loss related to PCOS, perimenopause, menopause, insulin resistance, or inflammation? And you have questions about what's going on in your body and how can you help the healing process? Then you're going to want to listen to this entire video. Hi, everyone. Welcome back to Nourish Your Crown. Today we have Amanda Rae Williams. Amanda is a nurse. She is a specialist dealing with and supporting people who are dealing with PCOS. She's also a functional nutritional therapy practitioner. So we are excited to have Amanda here today to give us all the insight information that we need to know about PCOS, hormones, inflammation, hair loss, and what we can do. I first met Amanda through Instagram, scrolling through Instagram, and saw her Instagram and loved her content. Loved Amanda. I love your approach to
Thank you.
addressing some of these issues. You're always putting out good information. And the fact that you responded so quickly and said yes, um, our Nurse Your Crown community, she's a keeper for us. So, welcome to Nurse Your Crown. Today we have some interesting questions and things to talk about. And we're talking about PCOS and hair loss and inflammation. And so,
All the good
first,
things.
yeah, the first thing we would love to do is to get started. Amanda, give us your background. Tell us a little bit about yourself. What drew you to the field of nutritional therapy? And then maybe even tell us a little bit about your personal PCOS and hair story.
So, as most things with health and wellness coaches, we kind of start seeking out ways to help ourselves. It was never my intention in the beginning to coach women with PCOS. I was just trying to figure out what was going on with myself. And from the early onset of puberty, I had PCOS symptoms, but I was not diagnosed officially with PCOS until well into adulthood because my physicians at the time refused to diagnose me because I didn't look like I had PCOS in terms of my weight,
Hmm.
which is not even a diagnostic criteria that needs to be met for PCOS. But they kept saying, well, your testosterone may be a little high, which is a diagnostic criteria. And your hair falling out might be stress. And I wasn't a nurse then. I had no medical training. All I had was what my doctors were telling me, and I was like, okay, well, if it's not that, what do I do? So, they put me on birth control for the excess hormones or which are nothing but excess hormones, birth control. And it helped with like my skin, but it didn't really help with any of my symptoms. So I just kind of went off of all the medications they put me on because the side effects were making me feel worse. Like
Hmm.
I was blacking out from the aldactone they put me on, which is a diuretic that is very commonly prescribed for PCOS, which again, they said I didn't have it, but they were giving me all these medications for it.
Hmm. Hmm.
And the birth control had me like crazy hungry all the time. I felt like I was reacting outside my body. So in my early 20s, I was just like, I'm not doing medications anymore. So, at the time I had no idea what insulin resistance was or anything, but I've always had I had a really dark neck. Like my neck has always been a little bit darker, but it was like almost black.
Okay.
I just thought it was from I don't know, being outside or my eczema. I had eczema really bad, so I thought it was like eczema scarring. I'd started growing hair on my face when I was in high school, but it was getting like out of
Hmm.
control. And then I started having thinning, and this is back in the day when everybody was getting a relaxer. So
Right, right, right,
everybody and their mama was getting a relaxer. So I thought it was just like, chemical burn.
right.
I wasn't sure. I had no idea it was related to like my testosterone levels or anything. So I always had like a triangle bald patch right here, and I would
Hmm.
do like a severe Aaliyah swoop to kind of hide it.
Right, right.
I would part my hair real deep and then try to hide it with the with the bangs,
Hmm.
and that's just kind of how I went through my 20s. I always had like a strong sweet tooth, like breads and pastas. Didn't know that was linked to it either. Super anxious all the time. Like my mom said my middle name should have been Stress when I was little.
Mm,
Had no idea that was part of it also.
mm-hmm,
So fast forward a few years later, me and my husband fall pregnant miraculously. Not sure how that happened with as bad as the state I was in, but
okay.
fell pregnant. And then after about 2 years after my daughter was born, I was at the lowest point. I was gaining weight uncontrollably, regardless of how little I ate. My hair was falling out. Like I had like a smooth spot at the crown
Mm,
of my head. It was
mm-hmm,
thinning everywhere. My little triangles were almost back to the middle of my head. I was
wow.
wearing these thick headbands all the time. But the thing that scared me the most was my mood was just as low as ever. I was thinking very harmful thoughts.
Mm,
And that is when I decided to reach out to a specialist. I saw a therapist and
mm-hmm,
she was like, maybe you need to tell your doctors what's going on. I went to them. I was like, XYZ, and they threw birth control at me again
mm-hmm,
and Lexapro, an antidepressant. And medication, I do not want to sound like I'm down on medication at all because some people are at a point where they're at the edge of a cliff and you need medication to keep you from going off that edge. And looking back, I probably should have taken it for a little bit, but with my nursing background, I just know how hard it is to get off of them once you
okay.
start, and I just did not want to start. But I do want to make that painfully clear that it is perfectly okay if you need medication to get through whatever you're going through, even if you intend to get off. That's perfectly okay. But me
Mm,
being stubborn at the time, I said, okay, I'm going to try to figure this out on my own. And so I started looking into diets for mood. I was reading these books called The Mood Cure and Grain Brain. I was really focusing on my emotions and not
okay.
my symptomology because I it was that dire. I was getting to a point where I hated waking up. So
Mm, yeah, yeah.
and with health and wellness, once you kind of start pulling at a thread, you can kind of go down a rabbit hole. And so I was doing like these extreme diets. I was feeling better. So I was like, if I'm feeling better, I can feel even better and even
Right.
better, And then you start like demonizing foods that used to bring you pleasure. I was like, I can't eat any of that because I didn't want to go back to that place. And you end up in a different spot when you get to an extreme. You're like constantly thinking about what's good for you and what's not good for you. And I was avoiding like social situations because I wasn't going to have anything I could eat there. And things just got to be too extreme. And when you live on one extreme, even if you're being too restrictive, you can start to have symptoms exacerbated again.
Mm,
So I finally went to an endocrinologist. She was a nurse practitioner because I was convinced. I was like, there is nothing you can tell me to that's gonna make me think I do not have PCOS.
right,
And
right.
she was like, you absolutely have PCOS. And I was like, thank you. This was like,
Right.
I'm like in my I was like in my late 20s now. And I said, I know I have PCOS. And she was confused about why it took so long for somebody to officially diagnose me, but
Right.
they just didn't know a lot about it um, back when I was younger and a teenager. And that is something I do want to let people know. Your doctor is going to be very hesitant, especially if you're a teenager, to diagnose you with PCOS because irregular periods, odd hair growth in places and weight fluctuations are just part of puberty sometimes, and they want to wait till
Right.
you're older before they diagnose you with PCOS. So if you have a daughter or if you're a teenager yourself and you're watching this and you're like, why won't my doctor give me that diagnosis? Well, they're trying to see how your hormones balance out as you get older before they give it to you. So,
Right. That's good. That's helpful
yeah.
because I'll say as I went back on my journey, I realized that I had symptoms as early as puberty, but I
Hmm.
wasn't diagnosed until I was in my 30s.
Right. Yeah.
And even then, there was no treatment plan. There was no plan of treatment other than the spironolactone. So we can talk about that later. But it was the same thing. I feel like it's there. There's so much conversation out about it now that I think there's more discussion happening around it. But
Thankfully,
that's
yes. There's a lot more
recent.
people talking about it. It is very
Yeah, that's
recent.
very recent.
Yeah, in the last
So
10 years alone, so much has happened. But anyway,
yeah,
I
yeah.
got my diagnosis and I was just really into my wellness journey. It was very still very self-centered. I just wanted to learn all I could to help myself.
Mhm,
So
mhm,
I enrolled in my certification program with the Nutritional Therapy Association, and that was a year. And then I went on to learn about functional lab testing, and that was like another 2 years of schooling I did. And I was sharing some information with a friend of mine who was like, "You know what? Do you work with people?" And I was like, "No, but I'll help you out, you know."
mhm,
I showed her what I did and it just kind of snowballed. I was getting referrals from people and I was like, "You know what? I'm a nurse. We teach people about lifestyle changes all the time." I said, "I have no issues coaching women. I think this is something most women should know and I don't think it's very commonly talked about, and there's a lot of misinformation out there, and we think it has to be way harder than it has to be. And so back in 2019, I started my coaching practice, and I really, my aim is to make things as simple as possible and as integratable into your life as possible because the the most minor things are the most instrumental and impactful in
mm,
change with PCOS because it's definitely not something you can cure. Let's get that out of the way now. It's not curable. It is largely genetic. It is our body's reaction and response to what is going on in our environment, whether that's our diet, whether that's the stressors going on in our life. It is how our body is reacting to perceived stress. And we can mitigate that reaction, but it's not something that goes away. We can just quiet our genetic expression of these
mm.
symptoms.
Okay, so I've read things similar. So it's I like the way you describe that too, and I apologize if the screen looped a little bit, but
Mhm.
so now let's go like let's do a deep dive into PCOS. People may not even some people may not even know the actual what it means. So polycystic ovarian syndrome. So can you
Yes.
talk to us a little bit about well, and also let me go backtrack. Thank you for sharing your story.
Oh,
And I
absolutely.
think there's probably I'm going to guess there's going to be lots of us who can resonate with some of the things that you said. But so what actually is PCOS, polycystic ovarian syndrome? Are there different types? And what are some of the key, you talked about this a little bit, but what are some of the symptoms? And then also even thinking about like, are there tests and things that people should be thinking about?
Yes. So PCOS stands for polycystic ovarian syndrome. It is a terrible name because the name focuses on the symptom that is the least indicative of PCOS, the cyst. You can have cyst if you do not have polycystic ovarian syndrome.
Hmm.
So,
Hmm.
what polycystic ovarian syndrome is, it is a metabolic syndrome and it is a hormonal dysregulation syndrome. And when I say metabolic, it is the energy production and the hormone synthesis and regulation in our body is thrown off because we are responding to stress in a number of ways. It could be that we are producing too much insulin. So when
Hmm.
we produce too much insulin, this we're discovering may have been a survival technique by our ancestors. So it's I really like to look at it as a superpower. And stay with me with this. People are like, what? But our ancestors millennia ago, women who had what we call PCOS syndrome, their genetic material tend to survive to carry on through their ancestors to present day because women with PCOS do not ovulate as much, right? We tend to have fewer periods and we tend to have trouble getting pregnant. So our ancestors, when there was perceived stress, like there was famine, there was drought, there were unsafe conditions, we released excess insulin, which prevented us from ovulating, which prevented us from getting pregnant in a dangerous space. So we're not having all these
Hmm.
children because there weren't birth control pills and prophylactics back then. So women weren't getting pregnant as easy because the space wasn't safe, and so they were able to survive. And also, we produced more testosterone, which made us stronger, which made us faster. We also were able to hold on to weight. So when there wasn't a lot of food around, we lived longer. So it was really
Mm-hmm.
to our benefit to have what we call today PCOS. But now we fast forward to present day, and stress is everything.
Right.
Everything is stress. Like
Right.
we have food everywhere, but a lot of it isn't stuff our body recognizes as food. So we're eating all this junk, but our body still thinks we're starving because we're not giving it the nutrients it needs. We're giving it
Okay.
synthetic oils, we're giving it artificial colors. So it's like, all right, obviously we don't have enough nutrient food here to create, hold, and grow a baby. So we're just gonna calm down on ovulation for a little bit. Um, when we're at work, we're constantly stressed. And when we are stressed, we release cortisol from our adrenal glands, which raises our blood sugar, which causes us to release more insulin to handle that blood sugar. So we're constantly raising our insulin when we're stressed at work, when we're stressed at home, when we're looking at all these unpaid bills we have, when we're beating ourselves up for eating that extra donut. It's a constant stress that our
Mm-hmm.
body can't tell the difference from. It can't tell the difference from a stress from us running from a lion and our everyday stress that we just didn't have to deal with millennia ago. So we never turn it off. So our PCOS symptoms are always on. We're releasing more testosterone because we have all this insulin, or we're hurting our thyroid because of chronic stress or under eating or extreme dieting, or we
Mm-hmm.
may have, which is very common with women especially, an autoimmune disease, which is usually fueled by inflammation, which is seen as a stressor on the body, which causes you to release more insulin. It's everything is connected. And when we say type of PCOS, it makes it sound so finite and like there's a rubric you need to check off and like, okay,
Right.
you're this type. But in all actuality, we have many different drivers at,
Mm,
at,
okay.
at one time. It just may be that your primary thing may be insulin resistance, but you also have an adrenal component where you're not producing enough cortisol, or you're producing too much cortisol, or you're producing too much of a androgen, a male hormone, DHEAS,
Mm-hmm.
which
Mm-hmm.
is like the brother to testosterone. You may be producing too much of that. And you may have a thyroid component, which 1 out of 4 women with PCOS do. And they're
Mm-hmm.
all kind of working together to produce your symptoms because PCOS is not a disease. It's just a
Right.
collection of symptoms that usually occur together at the same time, which makes it a syndrome. And
Okay.
we can turn them off.
So that's the good news is
Yes.
that it's not, it
you
doesn't
you
have to, it doesn't have to, they don't
you
have to
can you can
always stay in full gear, right?
no. No, you can turn them off because I mean my hair grew back. Um, I still deal with facial hair because once hair becomes terminal, it stays that way, but it definitely didn't spread. It was starting
Mm-hmm.
to
Mm-hmm.
go up my whole face. And mood is definitely more stabilized. And as you go through different phases in your life, we're always going to have something happening.
Mm-hmm.
You'll know how to handle it better to keep from spiraling back into
Mm-hmm.
those plaguing symptoms that we tend to get with polycystic ovarian syndrome. I really wish they're thinking about renaming it. I'm
They
hoping they
probably
do.
should. They probably should.
Because
So,
yeah,
it,
I'm sorry, go ahead.
no, no, go ahead.
Because the three I need to go over the three things you need to be officially diagnosed with polycystic ovarian syndrome.
Mm-hmm.
You need to have irregular cycles, and they usually define irregular by less than 10 menstrual cycles a year.
Okay.
You need to have evidence of elevated androgens. So they don't need to test your blood according to the diagnostic criteria to do this. They can just look at you and see if you have male pattern hair growth or male pattern baldness, and they'll be like, all right, you have an androgen issue. So
Mm-hmm.
if your doctor did not test you for elevated androgens, that's perfectly fine according
Mm-hmm.
to the diagnostic criteria. So you need to have irregular cycles, evidence of elevated male hormones, either by looking at you or from a blood test, and you need to have cysts on your ovaries verified by ultrasound. And out of those three, you only need to meet the criteria of two to be diagnosed with PCOS.
Okay. Okay.
So the cyst one, so many people who have cysts on their ovaries don't have PCOS.
Mm-hmm.
That's one I wish they would get rid of. But it needs to be verified by ultrasound.
Mm-hmm.
Usually it's the first two that
Okay.
gets people diagnosed with PCOS.
Okay. And then this might be, I don't know. Is this a recent, but is that recent that those three, or was that
Mm-mm. It's
it's
called the
kind of a
Rotterdam criteria.
okay, okay. So
Yeah.
interesting. We'll have to talk separately about that because that
Okay.
because I did what the thing that was a little bit sort of, and people who watch the channel, they kind of know my story a little bit. But I don't even know if I ever had the cysts. But definitely had the hair, my hair is back now, but the hair major hair loss.
Hmm.
Definitely here. But I never really had the lack of a menstrual cycle. It was really almost like clockwork. And so that led me to think more about being insulin resistant and versus the other area. But anyway, that's kind of neither
And it
here
can
nor there.
depend
Yeah.
on when you go to have symptoms assessed. You may not be expressing a
Right.
lot of symptomology and be like, no, you don't have it because it really is like a spectrum syndrome.
Mm-hmm. Mm-hmm.
Um,
Yeah.
and some people are just more sensitive to higher amounts of insulin and testosterone than others. That's why you'll
Yeah.
see some
Yeah.
women with severe hair loss because they
Yeah.
may be producing a lot more DHEA
Mm-hmm.
than they
Mm-hmm.
are testosterone. So I do see that a lot. Women's blood work will come back normal for their testosterone levels, but blood work isn't the best at testing free testosterone. Urine
Mm-hmm.
and saliva is better for testing free testosterone
Okay. Okay.
and also DHEA, which comes from our adrenal glands, which is the more kind of potent form of the male hormone, which
Okay.
can cause the
Pause.
excessive balding and
Yeah.
everything.
Yeah. And mine, when I was this last episode that I had, literally the whole crown was pretty much
Mhm.
gone, and then here, and then here, but
Yep.
then there was all of this here. Like so, it's yeah. So in thinking about, so a lot of times I think I've seen a lot of things with a lot of women that are on the younger spectrum, but what about women who might be perimenopause or menopausal or even, you know, what does that look like in terms of either the PCOS diagnosis or insulin resistance as you age, essentially? Because a lot of the audience on this channel are like 35 and older. There's certainly younger women, but a lot of them are 35 to 55 to 65.
Right. Because there's
Mhm.
so much emphasis placed on like the reproductive side of
Yes.
PCOS. And the biggest danger for, in my opinion, for women with PCOS and just statistically with disease processes is heart disease and diabetes. We
Hmm.
are way more likely to develop heart disease and diabetes because reproductively, we are naturally going to stop menstruating as we age. So don't think that as a symptom of your PCOS necessarily as you get older. We only have so many eggs left to ovulate. And
Hmm.
depending and hair loss is so complex. There's so many things that play a part in our hair growth as women. As we age, we naturally start to produce less progesterone because we're not
Hmm.
ovulating. We produce progesterone when we ovulate. And our ovaries stop making estrogen. So we start to see other bodily changes like, like vaginal dryness. So those are things that are just going to naturally happen as you age. And our hormone production, our sex hormone production primarily comes from our adrenal glands when we age because our ovaries stop producing it. So our adrenal glands kind of take over for us. So for women who are older, and I love that it's gaining ground now. Self
Hmm.
care is so important. You have to
Hmm.
learn how to manage your stress. And, bioidentical hormones are now a lot safer than they used to be. So there's an easy way for us to make that transition and, keep the hair on our head and keep our DHEA production down because when our adrenals take over our main sex hormone production after we reach menopause, if you have stressed your body out to the point that it's constantly pumping out these stress hormones, your menopause symptoms and hair loss symptoms are going to be
Mm,
a lot worse than they had to be. It is it's it sounds overly simple, but the things you can do to lessen the pull on you and the strain on you in your earlier years behind me, will make it a lot easier for your adrenal glands to transition you into menopause later on. And things that help produce, they have like a progesterone effect. Vitamin E is
mm,
mimics progesterone a lot, and it can help with things like insomnia, the hair growth, and pure vitamin E, um,
mm-hmm.
tocopherols, not the vitamin E that you might find on the Walmart shelf that's mixed with a bunch of other stuff. But
Okay.
vitamin E
Okay.
has a very progesterone mimicking effect that you should be incorporating daily. You can get vitamin, E from fatty fishes and
Mm-hmm.
avocados and things like that. But that is one supplement that I take all the time because women with PCOS and especially aging women with PCOS deal with progesterone
Mm-hmm.
deficiencies
Hmm.
at higher rates than women without it.
Yeah,
Um,
I have never heard that before, even with all the things that I've been reading. This is the first time I'm hearing
mhm.
about vitamin
Oh,
E
yeah, vitamin E.
that's good.
And you
That's good.
and with hair, any hair and supplement, they have those vitamin packs for hair and nails. They always have
Mhm.
like vitamin E in them, but vitamin E really is very, and it's not just because it's great for hair and nails. It has a progesterone, and progesterone is like a feel good hormone. It helps with our
Mm,
lubrications of our vaginal tract and our hair growth, our skin and nails, our sleep, our mood. Progesterone is very much indicative of how we present and how we feel to the world with PCOS. And it's not just making sure we have enough progesterone, it's making sure it's in balance with estrogen.
mhm,
We just
mhm,
don't need like all this progesterone. It needs to be in balance with our estrogen, and things that can take it out of balance are not sleeping.
mm.
Like staying up all night will throw your estrogen balance off. A bunch of refined foods, high sugars, seed oils, they'll throw your estrogen all off. Excessive amounts of caffeine, alcohol, all the fun stuff.
You're like, nope, can't have it. Or
Right,
not
and that's
the
the thing,
same.
right?
It's
You can
not in
have
not
it,
in
but
excess. Not in excess.
right, yeah, right. And
Yeah.
we just need to be conscious of it because a lot of times we just eat and don't even realize we're doing it.
Right,
And because
right.
food is everywhere, it's everywhere. And
It literally.
estrogens are everywhere. Estrogens that throw off our progesterone balance are in the air. It's in car exhaust. Car exhaust is full of pseudoestrogens. Our
Wow.
water. That's why it's important to drink filtered water.
Hmm.
Have a bunch of hormones and chemicals in them. These endocrine disruptors that throw us off as we age, especially.
Wow. So let's talk a little bit about inflammation, right? So I know that there's excess inflammation, but then excess inflammation related to PCOS. And at the same time, maybe let's start to weave in the connection with hair loss. Um, and what is it? What are the triggers for it? And then maybe even talking about what are some things we can do to help reduce excess inflammation.
Okay. So inflammation is a good thing. I know we hear that inflammate we need to decrease inflammation, turn off inflammation, but we need to inflame to
Hmm.
survive because it's our body's way of protecting us from outside invaders. The problem happens when we aren't able to turn it off, when we're constantly triggering our body's army to come attack something, and our body, after a long time, it gets confused and can start attacking itself. That's where autoimmunity comes in.
Hmm.
And hair growth is not the body's priority.
Mm,
We need raw materials to grow hair, to grow nails. So when our body is constantly using the resources it has to fight off infection or or trying to regulate chronically high blood sugars or
Mhm.
trying to repair damage in arteries and stuff like that. It just doesn't have anything left over to grow hair or
That
to
is
or to grow.
fascinating that you would present. I love the way you say. I'm sorry to interrupt. I'm like,
No, you're
that
fine.
makes perfect sense.
Yeah, I mean, hair is nice, but it's not necessary for us to live, right?
Mhm.
So our body's like, I'm trying to keep you alive right now, and there's there's a lot going on in here. And then you're not feeding me the raw materials I need to fight off this
Mm,
infection. So the body will rob Peter to pay Paul. It's like,
mm.
okay, you're not eating enough protein, so I'm gonna steal some protein from this muscle. And since I'm having to steal some protein from this muscle to create antibodies and deal with this chronic inflammation, you're not gonna have any protein left to grow hair. So
Right, right.
right.
So that is so. First of all, too, I want to tell the audience, please hit that like button so that more women can hear this interview. We need to hear this interview and this information from Amanda Rae. So hit that like button. And then also, if you're in the comment box, please leave a comment about your experience with PCOS or hair loss or regrowth. We'd love to hear everyone's story because the more we talk about it, the more it becomes real. But we know we're not in it alone. So I just wanted to share that with everyone. Okay, so inflammation, excess inflammation, our body
So
hair is not the priority, but we need to
it's
feed it the
not.
right things.
And honestly, so our body's main priority is keeping our blood sugar stable because we have to have glucose to run everything in our body. That is like its number one priority. So ovulation is not a priority for the body. Um,
Mm.
Hair growth is like the last thing it's focused on. Digestion, it's a priority, but it's low. It's trying to keep the heart beating and the blood sugar stable. So anything that is throwing those off, it is going to divert resources to addressing that first, whether that's pumping out more insulin, whether that is activating stored glucose in the liver, whether that is taking stored glucose from the muscle. It's going to do that first. So things that can inflame us, people may be like, well, what's making me inflamed? um, Food that's not food, meaning stuff that's synthesized in the lab and added with all these unnatural colors. Our body be like, I don't know what this is. Okay.
Mhm, mhm,
So gaps can form in our gut, and not chewing your food can trigger inflammation. So our stomach doesn't have teeth. It doesn't have teeth. So when you have all this unchewed food in chunks, our body can only break it down so much. And when it gets to our intestine, it kind of squeezes through our little intestinal gaps, and that's where you
mhm,
get the term leaky gut from. And when you have this undigested food kind of getting leaking out of your gut into your body, it hasn't been broken down into its simplest form, which is carbohydrates, which is simple sugars like glucose, amino acids, which comes from our proteins, and lipids, which comes from our fats. Our body knows what those are, but it don't know what that half digested chicken nugget is.
right,
So
right.
we get these food particles that aren't digested properly. Our body thinks it's an invader. So our immune system's activated. But it's little bits over time. And then when it keeps
Mhm,
happening, our immune system is just like, okay, okay, okay. And that's when we develop food sensitivities. It's like, all right, enough. Like now you're
mm,
allergic to soy because we keep getting undigested soy particles and activating our immune system. And after so many times of this happening, we develop things like endometriosis, which is an autoimmune
mm,
disease. We get lupus, we get Hashimoto's thyroiditis, because once you get one autoimmune disease, you're likely to get 1 to 2 more every
mm.
10 years. Every
What?
10. Mhm. Yeah. It's rare that you'll just stop at one autoimmune disease. You tend to gain another one every 1 to 2 every 10 years if you don't
I'm
deal with
writing
the
this stuff
inflammation.
down. That's why I'm like, what? So why you see me? If you see me looking down, it's because I'm taking notes.
Right.
Okay.
And
Wow.
I know I mentioned sleep, but sleep, when I tell you sleep is there's so much we have to learn about sleep, but sleep is so integral to repair and letting our body calm down and
Mhm,
eliminate waste and release human growth hormone, which we need for muscle repair, tissue repair, hair growth.
Hmm.
If you have poor sleep, your insulin sensitivity decreases by 30 to 40%. Like, I track my blood sugars constantly, and I can tell when my blood sugars are going to be high in the morning just based off of how I slept that night. That's
Wow.
how important sleep is. And one night of poor sleep can disrupt your hormone signaling and increase your inflammation markers. Um, so yeah, lack of sleep is a source of inflammation. Crap food or foods, undiagnosed food sensitivities are sources of inflammation. Prescription medicines, prescription medicines, you see the commercials. Yes, we'll help you with this, but these side effects, let's all list them out right here. It's like
Right.
25 different side effects, which I hate the term side effect because it kind of minimizes the effects that they have on the body. It downplays, like, oh, you may have a little anal leakage, but that's a big
Mhm.
deal.
What is that? Right.
No, that's an effect. That's not a side
Right.
effect.
Right.
That's a
Right.
full
Right.
effect. And
Right.
yeah, so prescription medications you're on can cause stress on your liver, which can increase inflammation, which ends up increasing your cholesterol levels. So that's why we pay close attention to cholesterol levels in women with PCOS, because elevated cholesterol is a sign of inflammation in the body,
Mhm.
which is part of
Okay, so
metabolic syndrome.
that's a good one to know because there's one thing where you because they're having done I don't know if I've done a formal cortisol. I think I did do a cortisol test, but it's I think it's interesting to have other markers. What else can we look at? Because sometimes you might get a cortisol test and it's fine, but you know something's off. Like you might know that you have other things like the cortisol. I heard one doctor say like you can if you take like one of those alkaline strips and test the acidity, that's a good way. Like if you're if you're very acidic, that could be an indication that your cortisol is elevated. Have you heard that before or
I have not heard of that test,
okay.
so I can't confirm or deny that one. But what I will say about cortisol, so a lot is dependent on cortisol levels. We can't just take one cortisol level. Our cortisol is released in a rhythm. It is highest in the morning and it should be lowest when we go to bed at night. So it matters when your cortisol level is being taken. The best way to measure cortisol is usually in four different samples. One you
Okay.
draw when you first wake up, in the afternoon, in the evening, and right before you go to bed. And it needs to be a saliva cortisol test
Mm,
or a urine cortisol test.
okay.
Blood blood is not a good way to test cortisol levels because that tests the protein bound form and not the free form, which is the active form that's doing anything.
Okay.
So it needs to be for either saliva or urine, and it needs to be taken at different intervals. Because if we're checking your cortisol levels in the evening and we see that they're low based off of one measurement that says it's supposed to be this or this, well, it's supposed to be low in the evening. That's when but if your cortisol is elevated in the evening,
Hmm.
there's an issue going on there.
Okay.
Um, you,
Okay.
you may have adrenal hyperplasia. You just may be super stressed out at that point in the day. So most physicians, some will do a 24-hour urine collection for cortisol. Some will give you a steroid to take the night before and then have you come in like at 8 a.m. and have your blood drawn,
Hmm.
which is a little better, but saliva or urine are the best ways to get them tested. And just go to
Okay.
an endocrinologist usually or a women's health specialist. I do run them on not patients, clients who
Hmm.
ask just to see what their levels are. Because I'm under a physician who runs the
Hmm.
labs for me,
Okay.
and those are ways to test how much stress hormone you're releasing. But you really don't. I don't like people to get caught up in testing because they are
Hmm.
tools. They're not the end all be all. Um,
Okay.
they just give us an indication of where we might need to go next, but there's so much you can do, so much
Hmm.
simpler without starting to spend a bunch of money on testing because
Okay. Okay.
you can go into a rabbit hole just chasing tests and
Yeah. Yeah.
trying to
I'm
get things
I'm
perfect.
guilty. Yeah, I'm guilty
Oh, I was too.
uh, of going there until you realize like I'm not paying all this for this, and then look for other ways. So let's do. So we've talked about PCOS, we've talked about inflammation, we've talked about hair loss and even hair growth. Sort of for this section, let's close this particular section out with okay. So what are the two or three things that someone can do, having listened to this, like if they have PCOS, if they have excess inflammation, if they have hair loss, what are a couple of things that they can do, easy, approachable takeaways? Because we're going to talk to in part two, we're going to really do a deeper dive on nutrition and supplementation and wellness and self care. But
So, since the focus of your show is hair loss, and if you have PCOS, the first thing I would advise you to do is to rule out underactive thyroid. You need to make sure, because it's going to be so hard for you to make any kind of headway, because underactive thyroid can mimic all of these symptoms that are plaguing you that you think may be your PCOS. So the hair loss, the weight gain, if you are intolerant to cold, if
mhm,
you have dry, flaky skin, if you are very anxious, if you tend to gain weight around your midsection or have like the purplish looking stretch marks, those are very good indicators that you have a thyroid problem, an underactive thyroid, and you need to go get that addressed first,
mhm,
because without fixing that, our thyroid is like our temp it's our pace setter for the rest of our body. It sets our metabolic rate. So that would be the first thing. And
mhm,
everything that I'm going to mention subsequent to this will help with thyroid issues, but you need to make sure that's been ruled out. You need to prioritize sleep. I cannot, when I say prioritize sleep, you need cut it off. Like, put the phone down, turn off the TV, make your room so inviting. Whatever sprays you need to do, your bed needs to be only for sleeping and procreating activities. That's all you need to be all you need to be doing in bed, because um liver non-alcoholic fatty liver disease is very common with women with
mm,
PCOS, where we get fat, like our, it's like our liver has cirrhosis around it.
mm,
And s- not sleeping can impact that. Um, Sleep is when our liver goes through its phase one, phase two detoxification processes, which helps turn off those excess hormones and helps us eliminate them through our bile and our urine and our feces. All this happens when you're asleep. The human growth hormone is released to help us with tissue repair, insulin sensitivity, and hair growth when we sleep. We don't
mhm,
really understand clearly why sleep works this way, but it does. So prioritize your sleep. The third thing I would say is make sure you are eating enough food. Um, and I don't mean that you're making, you're going back the third time to the buffet because you think you're not getting enough food, but
right.
we have been told so much in the PCOS community that we need to lose weight, that we think restricting our calories down to nothing is the way we're going to do it, when in actuality you're just hurting yourself more, because our bodies don't feel safe. They don't think we have enough food, so they're like, obviously there's not enough for us to eat out here, so we need to hold on to this weight. We need to ramp down our thyroid activity so we're not burning as many calories. And then
Mhm,
you hurt your thyroid when you undereat, and you store excess weight when you undereat, and then it's not sustainable. You binge. You, your
right.
body just like, you know what? I need to eat this whole box of donuts. So eating enough food and prioritizing protein and fiber,
Okay.
especially first. Protein and fiber. Fiber is it's kind of like the mop for our gut. All that when we eat, we may have a lot of food residues and stuff left over. Fiber is hard for us to digest. So it kind of goes through like a claw because it's not being digested and pushes all that other stuff out. So, and it also slows down how fast we absorb glucose into our system, which keeps us from having those insulin spikes. So, prioritizing proteins and fibers and not skipping breakfast. And I know I talk about breakfast a lot on my channels, but there is this Turkish study done, and there's so much more emerging evidence showing that the timing we eat matters just as much as what we're eating. Because if you are
Mm,
having these super large meals, so like I said, cortisol is released in a rhythm. When it is at its highest, we are at our most active usually, which is supposed to be at the beginning of the day. So we need to be eating in order to correspond with that rhythm. So our largest, most protein-packed, calorie-dense meal should be at the beginning of the day when we need that energy to sustain us throughout the rest of the day. Because you don't want to give your body all this energy it has to process right before you go to bed. Because now,
right, right.
instead of repairing and detoxifying, your body is focusing on digesting in trying to sort out all this excess glucose that now it has to store because you're not store as fat and because you're not moving around and store as fat in your liver because you're not moving around.
Hmm.
So breakfast helps to get us in that hormonal release, that circadian rhythm, and it helps to sustain your blood sugars throughout the day so you're not having the cravings and the binges. So yeah, starting with a protein rich, fiber rich breakfast, and it doesn't have to be a lot. People think that they have to sit down and eat this grand slam breakfast. No, you don't. You don't have to do that.
Right.
What did I had two boiled eggs, some berries, and what did I have this morning? And a cup of green tea that I put a little protein powder in, collagen
Hmm.
powder in. That's what I had this morning because I wasn't super hungry, but it helped get my metabolism going for the
Hmm.
rest of the day.
Hmm.
And it let my body know, like, okay, I'm going to get food. So it's all right if
Okay.
we break down some of this adipose tissue and
Okay.
use it for something else.
All right. Okay, cool. Okay, so the three things. Get tested for
I may have
underactive
gone to four.
thyroid.
Right.
Maybe, but it's okay. Get tested for underactive thyroid. Make sure you get that test is the one thing, right? So the second thing is to sleep, which is really
Sleep.
important. And then the third thing, which included a couple things, but really making sure that we get the right um, amount
Just you're
of
eating enough, right?
food, the right amount of food, and really focusing on protein and fiber, right? So those are
Yeah.
the tips
Because I
there.
guess the overarching theme is we need to make sure our body knows that we're safe.
Mm.
So
Hmm. Hmm.
sleeping and eating enough food are two of the best ways to know, like, hey, it's okay. We can ramp some of this
Yeah,
stuff down.
yeah,
We're not in danger as women with PCOS, and we can stop putting the troops on alert, and we can have
yeah.
some more enriching things like hair growth and
Yeah, yeah.
it's
So
all right.
I am gonna go listen to this again and again because there is so much good information in this. I have my notes too. So we're gonna wrap this session up. So where can people find you? Can you share? And I'll have it in the description box as well. Where can we
Yes.
find you and
So
follow you?
so my website is amandaraewellness.com. I'm on Instagram as Primal PCOS, PRIMAL dot PCOS. And I'm on TikTok as Primal PCOS without the dot. And I will give you the link so you can post with this video. If you want to know what is driving your PCOS primarily, I developed a quiz people can take. It's real quick, and you answer about 20 questions with symptoms, and it'll tell you what your primary driver is, whether it's thyroid, adrenal, inflammation, or insulin resistance. And I have a PCOS blood marker toolkit for any test you want run with your doctor. It goes through signs and symptoms of what tests you need to ask for, what the ranges need to be, and it has a request form so you don't have to remember names of tests. You can just
Right.
check what you want and hand it to your doctor so you don't have to sit there and trying to remember things.
Okay, so everybody, you've watched this far or you watched this section, you need to go to her website and get this information. I can tell you what, had I seen this 3 years ago when I was trying to do this, I probably would be much further along in my journey. But so thank you so much for your time, your expertise, um, and just sharing all of your knowledge with us. This is really, really helpful. And everyone, make sure you follow Amanda, check out our website, download all the information, and we'll see you in the next video.